My name is Brianna Ferraro, and I worked alongside Dr. Holzberg from the SES department to conduct the research Speak Up, teaching self-advocacy skills to students with disabilities at the Speaking Center. About 2 million undergraduates have an identified disability and are entitled to accommodations. These academic accommodations are positively correlated with increased GPA, higher persistence rates, and a shorter time to degree completion. Data indicate that students don't use their accommodations often because they aren't sure how to ask for them. Self-advocacy could be defined as a person's ability to recognize both their needs and their rights. Self-advocacy strategies give students the tools to help them access their accommodations. One way to do this is through self-advocacy and conflict resolution strategies. The purpose of this study was to evaluate the effects of both conflict resolution and self-advocacy instruction on the ability of 3 college students with disabilities to request their academic accommodations in role-play and in situ conditions. We had 4 research questions. What are the effects of self-advocacy intervention on the demonstration of skills to request academic accommodations? What are the effects of a self-advocacy intervention on the student's generalization of accommodations? What are the university instructors' perspectives on the usefulness of using the self-advocacy intervention? And what are the students' perspectives about the effects of the intervention on their use of advocacy and conflict resolution skills? Moving on to our method and design. It was multiple probe across participants, and we looked at the participants' correct use of the 12 steps in the SACR instruction and the participants' ability to generalize the target behaviors in an in situ condition. We also looked at the generalization, which consisted of pre-intervention and post-intervention and maintenance. We had 3 participants that were purposefully selected, and the inclusion criteria included a documented disability and the university professors from who the students requested their accommodations. The setting was an urban public university, and the materials included the SACR curriculum, scripted note cards, and an audio recording device. The procedures, the pre-baseline data, the students met with the interventionist, which was me, to describe the study and select their accommodations that they wanted to request. The baseline data included role play requesting their accommodations from a mock instructor, and the intervention, which was explicit instruction on the 12 SACR target behaviors, which consisted of 4 lessons that lasted about 20 to 30 minutes, and we followed model lead test. The intervention. So there's 2 components. Component 1 was conferencing with the student to select their accommodations. Component 2 was the specific lessons for each target behavior, and this is taught using explicit instruction and role play scenarios, and self-advocacy, which was broken up into 4 lessons. Moving on, generalization. We had pre-baseline probes that were collected using role play scenarios with the university instructor, and post-intervention that was collected during role play meetings with the instructor to request and negotiate accommodations. The sessions were all audio recorded and scored using a paper pencil checklist. The results demonstrated a functional relation between the SACR instruction and students' ability to request their accommodations. All 3 participants generalized the SACR target behaviors in the in situ setting. Students with disabilities were able to learn the steps of the SACR instruction using a visual prompt in a minimal amount of time, which was the 4 30-minute sessions. If you look at the graph, you can notice the jump in level and trend. Discussion. The results were consistent with the similar studies that were conducted by Dr. Holzberg, and contributions. It added to the literature of the use of the SACR instruction. It was in an in situ condition, and it used an on-campus resource. The limitations was that we only had 3 participants that were all the same race, and the participants were purposely selected. The participants were also compensated with a $20 gift card. Some suggestions for future research is that the SACR instruction could be conducted at the Speaking Center in small groups to access workplace accommodations, and that the SACR instruction, including conflict resolution, conducted at the Speaking Center. Implications for practice. This method could be packaged and sealed up to be used in other university communication centers, and the SACR instruction could be part of an orientation program prior to the students beginning their classes. If you have any questions, feel free to reach out to myself or Dr. Holzberg, and thank you for watching.